Millions of women are living with pain, discomfort, and silence, told that it is just a part of life. It doesn't have to be. This is Healing at Your Core, where pelvic floor physical therapist Bree Allred brings more than 20 years of clinical expertise to the conversations women deserve to have. Real answers, real healing, no shame. And now, your host, Bree Allred.
Welcome to Healing at Your Core. I'm so excited for our guest today. We've got Dr. Steph Denniston with the Active Family Chiropractic with us, and we're really going to talk the ins and outs of pregnancy a little bit. It's a big transformation in a woman's life, and several women will go through this multiple times, these big transitions, not to mention the postpartum, but we're going to focus on the first part of it today. So, Steph, tell us a little bit about you. What got you into chiropractic care in general, and then why you chose to have one of your specialties be pregnancy?
Awesome. Well, I'm excited to be here, and I have been in chiropractic for 20 years now, and I chose the pregnancy side of it because I myself went through pregnancy when I was in chiropractic school, and it was hard, and I realized that it didn't have to be hard because I was adjusted through my pregnancy, which made my second pregnancy a little bit different. But that pregnancy was also really hard because I had a breech baby. So that was what really kicked me into the pregnancy side of things, because I was wanting to help moms deal with that different pregnancy.
That's really neat. So then tell me chiropractic in general. What led you down that pathway?
I was experiencing my own issues with my body and being in pain, and I went to a chiropractor. Not even a cool story, but I loved watching people get better while I waited to get adjusted myself, and that was it.
You're like, I'm in on this.
I'm in. Yeah, I loved it. So
cool.
That was what took me down the chiropractic route.
Okay.
Yeah.
I love it. So we're going to talk about a common myth.
Hey.
When you're pregnant, most women think that it's like, oh my goodness, I'm going to be in pain. Like, it's just part of pregnancy. So tell me what your thoughts are about that. It's like, oh, this is just normal. And when one of my taglines a little bit is that common isn't normal or doesn't have to be normal, that we can challenge that nomenclature that it's like, yeah, pregnancy presents some challenges in your body.
Absolutely.
And it doesn't have to it doesn't have to equate pain.
With pain, yeah. It's interesting because pregnancy, I have so many that come in on their subsequent pregnancies after they've been in pain for their first and seen me through their first and was like, I'm not going to do that again, because they learned that actually pregnancy doesn't be that way. And the fact that we have been societally told that, oh yeah, you just have pain in pregnancy, it's a bummer, but it is absolutely avoidable. And we, as chiropractors, pregnancy chiropractors, can balance out the pelvis and the hips to make your body work better for you during whatever pregnancy you're on.
Yeah.
Whether it's your first, whether it's your third, whether it's your 10th. But pain is not something you have to endure during pregnancy whatsoever. Does it happen? Yes. But enduring it is not.
You don't get a badge for making it through with the most painful pregnancy.
You definitely don't. And I don't recommend it.
Yeah.
Yeah. It doesn't have to happen.
Yeah.
Pregnancy is beautiful, and it can stay beautiful. Like without pain.
You really think about it. It's like your body grows a human.
It does.
From the small, we'll say it. I'm going to totally do, our male counterparts contribute a seed.
Yeah.
And we get to do all of the work of actually growing the human. It's a pretty incredible thing that our bodies do.
It is. I say that to women all the time. I'm like, grow babies. Our bodies are amazing. So
they really are.
Let's believe in it and know that we can make these changes for our body.
Absolutely.
We just have to get the right tools.
Yeah.
Yeah.
So what would you say are the most common complaints? Like, you've got somebody walking into your office. What are the most common complaints during pregnancy that you're going to be hearing about or treating?
The most common is probably sciatica. They get that pain down, like starting at the back of their hip, so to speak, and it shoots down into their bum or even lower into their legs. That's probably the very most common. And then pubic symphysis pain, the front, where
Some
that
people
pubic
call it
bone.
lightning crotch.
Yep. And that's real as well. And then just low back pain as well. Like their low back hurts. Starts to make them waddle, and probably
The pregnancy stance and movement, right?
Yes, yes.
Which ones would you say, from your experience, what things are normal in a pregnancy? What are normal adaptations that our body are going to compensate with or change? And what would you say are things that you're looking at and being like, oh, we've got to correct this, from maybe even really specifically from like an alignment perspective? What is stuff that you're like, oh yeah, we see these changes in pregnancy. Some of these are going to stay and are actually normal compensations or adjustments. And which ones are you looking at and being like, yes, we're going to try to realign that?
So the pelvis is obviously the home for the uterus and the baby to grow in. So we want that as stabilized and balanced as we possibly can get. So if they come in and things are twisted, we try to get that to be very normal. And then there's that lovely sacrum that sits in between your big
like that nice
bones.
triangle shaped
Yes.
bone at the bottom of your spine.
Yes.
Yeah.
That can be shifted one way or another against how your pelvis is sitting. So the big pelvic bones, how they sit, and we don't want them to be contradicting each other. So those are the big things that we try to get to work together so that the baby can be housed in there as suspended as equally as we possibly can get it.
Yeah. So those are the major ones that you'd be wanting to correct.
Yes, those are the major ones. And then I always check the ligaments up front because they attach it to the pubic bone, which the lightning crotch happens, I think, a lot of times because of that imbalance up there.
Yeah.
So getting all those working together, and the house is a lot better. And then it usually will make it so that the rest of the spine will sit better, and pregnancy can just be a lot more comfortable.
Yeah.
Because it does go all the way up their mid-back as everything else changes and their ribs get wider. We can't forget about that.
Yes.
Because it's a real thing.
Yes, for sure. So let's talk. I think we'll just kind of bounce ideas a little bit of like, what are the normal changes that it's like, okay, these are things that we commonly see that are normal changes that neither of us are really going to be like, yeah, we're not going to correct that. So like one example being our pelvis is going to widen just a little bit. And as long as that's happening pretty symmetrically, it's like it naturally has to happen to house a growing baby in your body.
Yeah.
And it's a normal compensation that's there. And I'm like, yeah, we're going to support that with some strength from my end, right? And you may support it just making sure that structurally or things are doing well.
Yeah.
But we're not really going to look to change that during pregnancy.
No, I mean, it's the body changes it so much for us that the best thing we can do, I feel like, is support it. So yeah, just making sure the muscles stay balanced between either of the things that we do. And the ribs also change, like I was just saying. So between those two places, because that is where the baby grows and grows, the ribs are also going to get wider in most places.
So a lot of women will see, especially during pregnancy, and sometimes we'll have some lasting changes afterwards. Like your bra size will often change. For most people, it's going to increase and be a little bit wider.
Yeah.
So you're going to have to go to a little bit bigger. Maybe like your cup size might increase a little bit too, but more from like the band, right? That it's like your rib cage is going to widen and expand as well.
And I feel like if we can support that top and bottom, the bottom just tends to stay balanced.
Yeah.
Because the other thing, that sacrum that we were talking about, that triangular bone, it will start to dip in a little bit as it starts to move away from open up so that pelvis can get wider. That's another change that we see that we just have to support, and hopefully it doesn't happen too early.
Yeah.
Because we want it to move so baby can make its way out. But when it's happening at 20 weeks and their low back hurts and they're getting sciatic pain, we try to get things to balance out so they're not so tight or immobile.
Yeah.
That's the other thing that will happen with moms, is like you actually have the immobility, and it won't work with the big pelvis bones to actually move.
Yeah. Agreed. And then I think from my perspective too, I would say that there's going to be a little bit of curvature in the spine because
Absolutely.
you can't grow the front of your belly
Mhm.
without some compensation from what's happening
Yes.
in the back.
Yes.
And I do see that curvature towards kind of more curving towards the front. Think of it mimicking what your belly does,
Yes.
right?
Yeah. Follows it.
Follows that
Yeah.
a little bit. And
Yeah.
then our posture, we see it compensate to where it's like you have to lean back
Mhm.
so you don't tip forward.
Right. Yeah.
So it's like you have to adjust your center of balance a little bit to where it's like, oh, if I'm constantly like my belly's growing and things are getting bigger in the front, I have to shift my top half back just a little bit to counterbalance that.
Yeah.
So that's something where I'm like, again, we want to find kind of our happy mediums, but that's something that I commonly see.
Yeah. Posture
pregnancy.
is huge
Yeah.
for pregnancy. And we as moms, I think, just naturally want to protect that as well. So we kind of get even a little bit more hunched around the belly. So reminding and being mindful of posture all the time as pregnant mamas is what makes things more comfortable. It gives baby more space. It gives you more space. Gives your organs more space. So I feel like if we can, again, support that stuff by just reminding them like, oh yeah, we're working on posture. It's so helpful for moms.
Agreed.
I mean, even when we're not pregnant, we get into our slump, so to speak, but then you add the weight in front of us and posture.
Weight and then how it stretches muscles. We get breast changes tend to get a little bit bigger and pull things to make more into that slouch posture.
Absolutely.
As well.
Yeah. It's a journey.
It is.
Yeah.
It really is.
And it's fun to be able to help them realize how to support it better.
Yeah. Okay. What would you say? I look at these as kind of like little pet peeves that it's like, what do women suffer with too long before they seek help?
Oh, I think low back pain is a huge one they suffer with. I would even say sciatic pain because we do it will just go away.
Yeah.
And I mean, whether we're pregnant or not, again, like it just does that. So anytime that we can get the body to go, oh no, like we don't have to, we have help.
Yeah.
Then we don't have to suffer with low back pain for long. But unfortunately, we as providers are not known enough to be like, oh, hey, we have support to go do that stuff. But yeah, back pain and sciatic pain they suffer with. And then by the time they get to us, we have to do some pretty good catch up a lot of times.
Okay. So with this platform and educating,
Yeah.
when should you seek help? If you're a pregnant woman, do you know what I mean?
Yeah.
When should you seek help? When is the time to maybe start that? To seek? Did it start seeing you maybe? And I can kind of respond to that a little bit from a pelvic floor standpoint as well.
If ideally, if we could have mom's pelvis in a really healthy space before they get pregnant.
Prevention. An ounce of prevention is worth right? I can't even remember the saying, but an ounce of prevention is worth like thousands of dollars of treatment.
Absolutely. When they get to kind of an emergency zone, so to speak, when they're not walking very well, when they can't do everyday activities, definitely get help. They don't endure. But yeah, ideally it would be in the very beginning because then we can get the pelvis in a good place and then baby can grow a little bit and we can check pelvis and then baby can grow a little bit more. And we make sure that that environment is so happy for everybody to give that baby space and mom the ability to let that belly expand with balance. Yeah. It's really fantastic to watch when they can start early.
Yeah. So I really think the answer to that for both of us is the sooner the better.
Yeah.
If you're trying to conceive, that might be a great time to establish some care. Or even if you're just like, we're thinking about having a baby.
Yeah.
Maybe getting an initial chiropractic assessment, an initial pelvic floor physical therapy assessment.
Yeah.
So that we're seeing, I really feel that pregnancy has a tendency to unmask dysfunction that's already there. Like we're compensating just below the surface and pregnancy all of a sudden is like, hello, I'm here and now I'm going to give you major problems. So oftentimes we can find those little things that your body is just managing very well. that pregnancy seems to not give you the capabilities to manage any longer.
Yes.
The increased demands kind of just really bring these to the surface.
Absolutely. I couldn't agree more.
Going forward, somebody's decided to seek chiropractic care with you. What does that look like?
Our initial visit, they come in, we sit down, and we do a history of where they've been and previous injuries potentially, or previous, discomforts that they've already been feeling this way. And then we go through and figure out where there might be a discrepancy in their pelvis for sure, between their sacrum and pelvis, low back, see where there's tightness, see where things aren't moving the best that they can. And we do that through an examination of between movement and muscle palpation or
You guys
structural
kind of like
palpation.
pushing or
Yeah,
touching things.
Yes. And then I always check the rest of the spine because it all goes together. So that's the main part of when they're laying face down. We have special pillows and tables that can drop away so belly has enough room so that you're not actually laying on belly, because that would be weird. And most moms can do it anyway. Yeah. And then when they turn over onto their back, we check ligaments in the front, diaphragm as well, just to make sure they possibly are getting breath work, like they're breathing okay.
Uh-huh.
Also, that heartburn can be a huge part of that. So that all gets checked. We do go through, just body systems on how all that's working, and making even sure they're not having headaches, because headaches are a problem, aren't fun during pregnancy as well. So that's kind of just like the simple part of it. I always check that moms are comfortable with us moving around and trying to communicate if things are uncomfortable, even having being touched. So yeah, it's pretty simple.
I feel like it works well.
Yeah.
Okay, and then I would say take us through like optimal goals, right? You're finding some discrepancies in people. When do people know that they're done with treatment with you?
Yeah. Done is usually after the baby comes. That's like a changing chapter point, but we don't, in my office, I don't necessarily go with a done. We try to get to a point of maintenance. So if that can happen during pregnancy, I find that most moms, if it works in their lives, they will come for probably at least the last month once a week, if not longer, just because we can keep that pelvis in a really good place. Mm-hmm. Some moms are rocking, life, and they actually keep their adjustments really well. So we roll with how the body is actually holding on to
how
the
it's
structure.
Responding, what your symptoms are like.
Yes.
I just feel like maybe some of the myths are that it's like, oh, once you go to a chiropractor, you always go to a chiropractor.
Yeah. Well, and the way that I explain this is that we always are going to have a spine, luckily, and it's kind of like our teeth. We maintain it. After, and I know this isn't exactly like, this is a whole nother discussion, but when baby is out, it's so nice to be put back together and get that pelvis realigned so that it will actually feel comfortable and move comfortably as there is no baby in there anymore. So we talk about that once baby comes, and then we go from there. I have, and I'm sure you have the same, but postpartum is a huge thing that we miss the boat on and want to put that body back together.
Yeah.
Especially if you're going to have subsequent babies fairly soon, but also just for your own comfortability.
Yeah.
Because lots of moms want to get back into running or their sports or fitness or life.
Or chasing after this baby as it grows up.
Yeah. Yes. And so if they can do that better. So it isn't, I don't look at it as a life thing. It's just maintenance. We don't necessarily stop walking and going to the gym or whatever your way is of like moving and stretching. That's something that we maintain forever. As chiropractors, we help that mobility the rest of your life.
I love that. to where it's like, it's like taking care of your car. You
Yes.
get oil changes every so often. You're doing
Absolutely.
swap outs of your wiper blades and filling your fluids.
Yeah.
It's that same idea.
And I love to give them the tools to maintain it at home.
Yeah.
Because that's important. You know, we see them for such a short period of time in the office that the maintenance outside the office is almost bigger. So we do give that education as well.
I love it. Yeah. So good. Tell me a little bit about if mom is carrying a breech baby. Can you help with that?
Yes. We see a lot of breech babies in the chiropractic world. And breech babies, I don't know if you are aware of this, but the midwife that I speak with the most, it's just a variant of normal, which is not how our society has been taught to know that. And there are bigger,
There are some risks associated with delivering a breech baby.
Yeah, absolutely. We want the head out first because then there's a brow.
Mm-hmm.
And the shoulders don't normally get stuck at, or at least the head's out if they
The
do.
head's a little bigger stretch than a baby's feet and pelvis.
Yes,
So
absolutely.
it
And
helps
shoulders.
prep for the shoulders a little better than coming the other direction.
Yeah, absolutely. So when they're not in the head down position, what we can do as chiropractors, again, is get the body or the pelvis ready for that structural balance so that hopefully that baby will be suspended in the middle of that pelvis the best that it possibly can so that it can.
So it's not stuck
on
on one side or being pushed into different places where it's like it doesn't have the capabilities to move.
Right. And if we can get the ligaments in that balanced position, a lot of times babies will find their positioning better. Moms will feel big, huge movements, and babies can turn into the position they want.
Yep.
If that's not happening because muscles and structures are way more stuck, that's when they look at that external version, but that is not what we do in our
You're not
office
moving
whatsoever.
baby.
No.
You're moving mom's body to help encourage baby to have places to move. Like that clarification.
Yes.
So let's talk a little bit about why would they see a chiropractor versus why would they see a pelvic floor physical therapist?
Okay.
Where do we overlap?
Okay.
And maybe where do we have our own independent kind of realms that we focus on? Because that's the interesting thing sometimes in these, I would call them body worker spaces, right? Massage therapy, acupuncture, chiropractic, physical therapy. Like we have some overlap within all of our professions and we have our own individual focuses.
Yeah.
So I'll let you speak to it first and then I'll kind of give my perspective on it as well.
So when I feel like they come to the chiropractic side is when we want some big structural changes with the adjustments. Like that's a really big part that chiropractically we do. The muscle tone, especially within the pelvis, you are the pro at. I would so much rather send people to you.
You're like, that's not where I'm going.
Bree has this. Like her crew, she's got this. Like, please go see her and get the specialty you need to get your pelvic floor ready to go and the structures around it. I think also with the incontinence, I will definitely send people your way because they need that extra help that you're the professional at on that. You're the pro and I am not the pro. I think we overlap in just keeping that pelvic floor in general in a better space, just a way more stable space. And both of the things that we can give them to do or we do for them in our office can absolutely stabilize the pelvis.
Yeah.
And sometimes the patient needs one versus another, so.
I would agree with that. To where, and once again, I'm going to try to make this kind of a generality, which we hate generalities, but the idea of I really think that your specialty area, and correct me if I'm wrong, I love these open discussions, is you're really looking at the bones and the ligaments attached to those bones and how they're pulling or asymmetrical or imbalanced and kind of restoring that balance.
Right.
And I would say from a physical therapy standpoint, my focus is a little bit more on the muscles and how do we support, and how are the muscles pulling on those bony pelvises, right? Those bones and those joints and things that way. And then I think our overlap comes from when you adjust something and you get it lined up, the muscle function improves.
Absolutely.
And I do think the overlap from my side a little bit is that it's like we do some things called muscle energy techniques. We do things within that practice that I'm like, I'm going to start here. If you need more than this, I'm going to send you to the chiropractor who's really the expert in adjustment.
Right.
If we're seeing some bony asymmetries and things that aren't moving great, I'm like, okay, that's more your expertise. And I do feel the overlap comes a lot from when the muscles are functioning well, we see the adjustments stay in place, and vice versa, right? When things are aligned well, I see the muscle strength doing what it's supposed to be doing.
Yes.
So
I fully agree. And then I feel like you have the pelvic floor part of it as well that I don't.
You're like, that's not your specialty.
Yeah, that is not my specialty.
Yeah.
That is definitely, I can give them some tips and just like modifications for how they're moving around, like not doing lunges, towards the end of pregnancy. Like I'd recommend that they stop doing that, or even whenever they hit it, because it's like shearing in your pelvic floor isn't its favorite thing.
It's just got a lot of
so much
demand,
pressure.
and now doing that movement creates more demand.
Right. Yeah. So, but beyond that, like I think you can help them with that pelvic floor very differently.
Yeah.
So
I agree with that.
Structure way more balanced.
But I think we work so well together in that, because it's like the muscles don't function if the bones aren't doing well, and the bones don't stay if the muscles aren't doing well.
Yeah.
And I have told so many people, I'm like, a good chiropractor usually will give you exercises.
Yeah.
And a good physical therapist, may do a little bit of joint mobility and mobilization, but it's more of like, where do I spend most of my time?
Right.
You're spending most of your time adjusting. I'm spending most of my time doing exercise. And we have a little bit of gray area in the middle where we each kind of dabble.
Yeah.
Is that a good explanation for me?
I totally
I'm like, this is how I explain it to some of my patients. I'm like, I dabble just a tiny bit in some adjustment and joint mobility stuff. Yeah. And you dabble just a little bit in getting exercises to support people so that your adjustments can be as effective and stay and hold.
Right.
But we're also saying, actually, our best specialty is when we're combining, or our best treatments and our best outcomes come when we can combine both, to where it's like we've got your beautiful specialty in joint mobility and alignment and posture.
Yeah.
And we've got my specialty in the muscle support to help keep it there.
They're so cohesive.
Yeah.
And I wish that it was just the way the pregnancy team went. It was like, you see your OB, you see your midwife, you see your chiropractor, you see your pelvic floor specialty, you see your lactation. I just wish it was like a very cohesive team that every pregnant person got.
I agree.
Yeah.
Because you can't be good at everything.
No.
No one person can be good at everything. Like, you need a team.
Yeah. And it takes a village.
It really does.
Yeah.
It really does. Both to take care of mom and for mamas as we're raising our babies.
Absolutely. But we got to get those babies here and happy. And when moms are happy during pregnancy, I think it just makes
it changes things.
A lot of,
It really does.
Their happiness and their even just like stress during pregnancy can make such a difference as baby comes out.
Yes. Yes, for sure. I agree with that. Let's just very briefly touch. Okay. We kind of touched just a tiny bit on postpartum.
Yeah.
I like to call it the fourth trimester.
Yeah.
So ideally, let's even focus on maybe like right after baby comes for 6 weeks, but then also talk about if we're taking a trimester is generally 3 months. Let's talk about the first 3 months postpartum.
Okay. So like I was saying previously, getting that body to come back together after it's been expanded to get baby out, and things have been stretched out for a while. And as they start to shrink back into their normal, so to speak, sometimes they don't go back into that right place, and we still have things off in the pelvis. So if we can start within those first 6 weeks, or just around like the 6-8 weeks, to get that pelvic floor or the pelvis back to that place so the pelvic floor can be in a good place, that is a beautiful start to getting your body back.
Yeah. So when would you recommend that somebody come see you postpartum?
My recommendation for moms is when they're comfortable.
Yeah. That's
So
generally my recommendation
that is
too.
the next day. If it is the day they have the baby, if it's 6 to 8 weeks,
I'm like,
know,
as soon as you feel ready to add something else to your plate. That's usually what I
yes,
tell them.
that is perfect. Yeah, I just said when you're comfortable. And
Mhm.
I have had moms stop on the way home from the hospital. They're like,
I need your help.
"Please just adjust me."
I was in weird positions.
Yes. So, but then for the next 3 months, it's so like a lot of change is happening too, because it isn't in the first 6 weeks for most. There are those beautiful women that get to like, get their bodies back really quickly. But for most, it does take 3 to 10 to 12 months to even get your body back.
Mhm.
And it doesn't even show up potentially until the 4th or 5th or 6th month that you're like, I've had the baby, my body hurts now.
Yeah.
Because it's been compensating or trying to figure out how to put itself back together.
Well, and the demands change afterwards,
yeah.
right? Now all of a sudden you're carrying a baby around all the time,
Yeah,
which is
in your arms.
you're not used to having weight here all the
Right.
time.
Yeah.
You're carrying a car seat, strollers, diaper bags. Like the
So many
demands
things
on
are
our
different.
bodies change. And we may be on our feet. If we have a fussier baby, we may be on our feet a lot more than maybe we were used to, especially during pregnancy.
Yeah. Or
So-
sleeping in weird positions.
Yep.
It's
So that you've got a baby that you're holding,
extreme.
or you're falling asleep in the rocking chair,
Yeah.
or
or you're on your side. And,
Yep.
Yeah. One leg's all crazy and your pelvis is like in a twist.
Yeah.
So, yeah.
But I agree with you that I was like, somehow society is just like, oh, 6 weeks, like you're bounced back,
Yeah.
you're all better, right? And it's
That would
like,
be
that's
amazing.
not how this happens. There's a general rule of thumb in the physical therapy world that it's like, as long as it takes you to get there, it's going to take you twice as long to get out of there. So I'm like 9 months to get there, 18 months to get out of there. And again, I say that's a general rule of thumb.
Yes.
Like your strength and your health going into the pregnancy is definitely going to affect things, your activity level, what you're trying to get back to. Like
Yeah.
all of these things play a role. But I'm like, just give your body some time. It really is. I'm like, just you're not better at 6 weeks. Just because the uterus is closed and wounds are healed does not mean that you're better at 6 weeks.
And I would say that most moms would agree with.
Yeah.
Yeah.
We feel it.
Yeah.
We do. It's like, you mean I'm better now?
Yeah.
Really? News
Yes.
to me,
Yeah.
right?
Yeah. And that's where it's so lovely that we can be part of their support after baby
Yeah.
comes, because we can remind them they don't.
Mhm.
It's okay that their body heals.
Here's
in
actually what's
a time
normal.
frame. Yeah.
For sure.
And if they nurse, it's like that 18 months for sure. It's
Mhm.
like it's a long time that your body is just rearranging.
And hormonally is rearranging or staying at a different level, and it affects things.
Yeah. So
Yeah, you're not better at 6
yeah.
weeks. Trust your instincts.
Yeah.
You know.
where that number came from is also very interesting.
There's not actually much behind it.
Uh-huh.
I mean, there's tissue healing. And that's what I would
For
argue.
sure.
I'm like, tissues are
Yeah,
healed
that's-
back
yeah,
together. Like if
that's
there's
fair.
been a tear, and like even from a muscular standpoint, like 6 to 8 weeks typically for a muscle to heal that's been
Mhm.
strained or torn. Like I think there's some physiologic data I think that comes behind it, but
Right.
that isn't back to optimal function.
Right.
Would you? That's
Yes,
kind of
I
my,
would
like from a
totally-
tissue healing perspective, I would say yes, we're healed. Like tissues that got torn are now back together and have adequate scar tissue to
Or
help
better.
resist there. And uterus is now closed, bleeding has stopped, like risk of infection is down. So you're like, yeah, for all intents and purposes,
I'm fine.
you're fine, right? It's like, well, your wounds have healed, but that doesn't mean that
Body.
everything's rehabbed afterwards.
Yeah.
Agreed.
I would totally agree.
Okay. This has been so much fun
Yeah.
to visit with
Yes.
you today. I absolutely
Thank
love
you.
it. I am just going to do some rapid fire questions,
Okay.
some things that are just
Do it.
fun for people to get to know you a little bit.
Okay.
So what's your favorite pregnancy tip?
Oh, wow. Okay, let me think for just 1 second. My favorite pregnancy tip is probably posture. That is where every time they come in, I will remind them, like to do their posture, open up their chest, lift their chest up, posture.
I love it. What is one thing that every pregnant woman should avoid? Talking from generalities that we hate, right?
Yeah. Every pregnant woman should avoid. That's a really good question. Honestly, being completely sedentary. That is one of the hardest. Is just sitting and doing. But when you feel comfy, it's really hard to not.
Yes.
Yeah.
What's your favorite guilty pleasure?
It just in general.
Mm-hmm.
Oh man.
Or maybe we even say guilty pleasure in food, and then just guilty pleasure for time or how you spend your time.
My guilty pleasure is being outside, riding my bike or skiing, depending on the season. And I would say food are probably
Any particular?
sure. Chocolate chip.
Chocolate chip cookies. Okay. You want a way to Steph's heart?
Yeah.
Chocolate chip cookies are your thing.
Yeah.
And then let's close with just what would you say is the biggest misconception about chiropractic care?
That it's not going to help.
Yeah.
That's probably the biggest misconception is that it's.
You're almost like I challenge you to try it and see what you think.
Yeah.
Right.
Yes. I would love to help you see a different side of that.
Yeah.
Yeah.
You're like, I can convince you otherwise.
So good.
Yeah. Okay. Well, thanks so much for joining me today. I'm so excited. How can people find you if they're like, hey, I want to go see Dr. Steph? How would they find you?
So we are located in Providence, Utah, on the south end of Logan. And then if they want it on social media, we're on Facebook as Active Family Chiropractic and also on Instagram as Active Fam Chiro.
Okay.
They can find us there.
So good.
Yeah.
Okay. Thanks, Steph.
Bree.
Appreciate it.
Hey.
Have a good one.
Thank you.
Thanks, guys, for tuning into Healing at Your Core. Be sure to subscribe and just keep looking forward to educating you on everything core related.
Millions of women are still waiting for someone to take their symptoms seriously. You found this show. Share it. New episodes of Healing at Your Core release every week. Evidence-based, non-surgical, and built around one belief: you do not have to live with this.